Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, something a little different. We're going to hear about an innovative approach to financing global health efforts. I speak to Nia Martin, a managing director on the social enterprise finance team of a little-known government agency called the U.S. International Development Finance Corporation. We talk about development impact bonds, what they are, and how they can make a difference. Let's listen. Nia Martin, welcome to Public Health on Call. I'm real excited to talk to you about development impact bonds.
Thank you, Josh. It's a pleasure to be here with you.
Now, you work for the U.S. International Development Finance Corporation. Maybe we should remind our listeners what that federal agency is.
Definitely. The U.S. International DFC is America's development finance institution. We partner with private sector clients to finance solutions to critical challenges facing the developing world. We also take into account U.S. foreign policy priorities as part of the BUILD Act of 2019. And to give you a sense of our scale, we have a portfolio of close to $40 billion. In 2021 alone, we made $6.7 billion in new investments, including $1 billion related to healthcare investments.
So the last time I was talking to someone from the DFC, we were talking about loans that were being made to build vaccine capacity in the developing world. But now we're going to talk about something different. Before we do that, I just want to emphasize something that I learned the last time, which is that the DFC is not an aid organization as we might think about it. They're not giving out grants for particular health projects and just watching the money go. You're actually, in a way, trying to make some money at the same time that you're doing good in the world.
Exactly. We are a financial institution and very proud to say that we are self-sustaining in our ability to provide financing for different projects globally.
Now, the reason I reached out for another podcast is because I heard about your work in development impact bonds. And could you explain first a little bit in principle what this financial mechanism is?
I'd be happy to. And DFC is really happy to be at what we consider the forefront of innovation as far as development finance institutions supporting development impact bonds. They're a really unique product offering where we can provide financing to development issues that at one point are not considered investable opportunities. But through these development impact bonds, we make them investable opportunities, which means on all sides, we can ensure better outcomes and a more efficient use of financial and human resources. And the way they are structured is in some ways similar to a typical financial transaction, but in some ways it's a little bit different. So DFC would make a loan to a client or make an investment in a client. And based on their success at achieving certain targets, that would determine DFC's return from that client. Now, the twist is this. The client can often be a nonprofit or a social enterprise. So the repayment to the DFC or the return to the DFC is supported by different donors, which are called outcome funders, that would provide support that's based on the ability of that client to sufficiently meet the social outcomes that are predetermined at the beginning of our investment in a project.
So if I'm a organization, a community-based organization, for example, and there's something that really is important for me to do, I might get a grant possibly to do that. But in this case, I have a funder who, instead of giving me the grant, says, how about this? You take a loan from the DFC, and if you do what you promised to do, we'll pay that loan back to them.
Exactly. And there will be that other party of donors that says, if you do what you promised to do, we'll pay that loan back to the investors. And Josh, if I could just interject, I want to talk about why that's really important to this community-based organization. A lot of times the grants that they receive are very limited in their use. So they can't implement programs with the breadth and comprehensive view that they would like to implement them. And also the grants may be for lower amounts than what an investor could provide. So they might be short term, where we can come in and provide longer term, more comprehensive financing for them to really execute on their programming objectives.
Great. Well, I bet there's some listeners going, I think I understand, but could you give me an example? So I'm going to ask you for maybe an example of the first development impact bond that DFC was involved with.
Yes, I'd love to provide that example as one of my absolute favorite projects. It's our Cameroon cataract loan. We were approached in 2017 to provide financing to the Africa Eye Foundation, which was setting up a world-class premier cataract institute in Cameroon. This was really exciting. They already, as a nonprofit, had put in a lot of time, effort, and resources into developing this hospital or this eye clinic. But they needed additional financing to complete and to also expand and offer services to clients. That's where the DFC came in, and we provided a loan based on certain criteria. Our loan was provided. We pre-agreed with them on the criteria. And if the criteria was met, we would be repaid by different foundations. And I can talk about those foundations as well as the Hilton Foundation, Sight Savers Foundation, and the Fred Hollows Foundation.
So let me get this straight. We have a problem in Cameroon, a lot of people with cataracts that can't get treated. You have an organization that wants to scale up to treat those cataracts. And you have funders out there that are willing to be supportive of it, but want to make sure that it really works.
Exactly.
The way this is structured is that the U.S. Development Finance Corporation give a loan that then the funders will repay if they do what they promise to do, if it actually works.
Exactly.
How big was the loan?
The loan was approximately $2 million overall. As I mentioned before, one of our goals is to mobilize other private investors. So we were able to mobilize an additional investor in as well for a small amount.
And what did this organization have to do to be successful?
There were 3 social impact objectives that they had to achieve to be successful. The first was to perform a certain number of surgeries within 3 years and within 5 years. The second is to perform high quality surgeries, because that's clearly something that is very important to us and very important to the funders in the organization as well. And this was according to a World Health Organization standard. And the third, which I think is really important, is they had to be self-sustaining after 5 years. So they had to have a positive profit metric at the 5-year mark.
I see. And so how are they doing?
They're doing well. To date, they have performed over 8,500 surgeries. They're now performing the highest number of surgeries since the pandemic has started. And they also have outcomes that are well above what the objective was when we first made the loan. So I would say that they're performing really well.
Now, the reason I actually reached out to you was not because of your first development impact loan, but because of your second. Could you talk about the second one?
Sure, I'd be happy to. And I think this just shows the breadth of ways that development impact bonds can be structured and used for development challenges. The second one focuses on refugees in Jordan and Lebanon that were affected by the conflict in Syria. So there was an opportunity there to support the refugee communities in those 2 countries in having a sustainable living environment to be able to provide for their families. So that is the premise of this bond. It's the Refugee Livelihoods Impact Bond. And I'm happy to go into more detail about how that was structured and the parties involved.
What is the organization that got the loan?
So we provided financing to the Near East Foundation, which is a phenomenal foundation that has over a 100-year history. It's a U.S.-based nonprofit in Syracuse, New York. And they have worked with refugee crises and underserved communities globally, but specifically in the MENA region in Eastern Europe and underserved communities in Sub-Saharan Africa.
And then what do they have to do for this to be successful?
That's a really great question. So the idea is they select individuals that are looking for opportunities to create businesses, but they're also looking for individuals that are at risk today as far as being financially sustainable. They provide training to those individuals and support them in developing business ideas, getting the training they need, as well as resources. And once those individuals complete their training, they're provided with a grant to start or expand their business. For this bond to be successful, there are two outcomes that they have to achieve. The first is the business has to be operational 10 months after they receive the grant to start or expand their business. And the second is we really want to be impactful with this bond. So we want to see that the consumption level of the families has increased because of this business. And this means looking at basic things such as their ability to put food on the table, to provide educational needs for their children, et cetera. So very excited about this impact bond as well.
So this bond is actually supporting refugees in their ability to develop businesses and be successful.
Exactly. And one nuance that I'd like to add, because I also think this is really important, is supporting refugees, but also a certain percentage of those that are supported are vulnerable members of the host communities. So in a way, it's really great because it also looks at the social factors and building community with the refugees and the host communities that are in those areas.
And who are the foundations or the funders involved that would pay it back if they're successful?
So the foundations are the IKEA Foundation, Novo Nordisk Foundation, and NORAD, which is the Norwegian Development Agency.
Interesting. Now, what happens if the projects don't work, and you don't get the number of cataract surgeries promised, for example, or the businesses don't work? The organizations may not be able to pay it all back. What winds up happening?
So it's very unique for each impact bond. So for some impact bonds, if they don't meet the objectives, we get a lower return. For some, we might not even get part of the principal that we invested. So it really depends on the structure for each impact bond. And what's very important, of course, in our work, we do the financial analysis, but also doing the analysis to see that that organization is able to achieve the social impacts that we've set out in the beginning. And the second point that I think is really important is also the hiring of an independent evaluator that looks at each metric to determine objectively if it's been reached.
So in a way, it's like any other loan that you make in that it could really work out for you or it might not work out for you. And you've got to make a good decision at the beginning about where to invest your money.
Exactly. But I think what's really unique and very promising is the way it directly links us to the social impact performance of the investment.
Now, I know that you've been sort of dipping your toe in this at the U.S. Development Finance Corporation. What is the future of this kind of financing?
So I'd say we're about waist deep now. That's what I like to say. We've dipped our toe with Cameroon. We were up to our knee with the Refugee Impact Bond, and we're extremely excited. Our board just approved an investment in the SDG Outcomes Fund. And this is the world's first impact bond outcomes contract fund focused on emerging markets. So we're at the very earliest stages with board approval, but we're really excited with that fund because it will focus on healthcare, gender equity, environment, and employment and education.
And how much are you hoping to be putting into that?
For that one, we've approved $15 million.
15 million. So I think you started by saying every year you do in the billions. Is that right?
Yes. Mm-hmm.
So still pretty small going to this, but do you see it possibly getting bigger over time?
Yeah, and that's absolutely our goal with investing in the fund. What we want to see this market, development impact, social impact bonds in developing countries, is still relatively nascent. Right now, I believe there's 25 of these across developing countries. So we really want to help the market grow. And as the market grows, there are more investable opportunities for us. And that's really our goal here with the DFC, to kind of grow markets and support investable opportunities for us, but more importantly for the private sector.
Well, so interesting and, potentially so promising for different kinds of health needs around the world, not only to address them, but to address them in a sustainable way. Thank you very much for explaining all this to me, and thank you for the work that you're doing.
Thank you. It's absolutely my pleasure.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.